Hi, I'm Dr. K.
Hi, I'm Alexa.
We're here from Modern Day Dental. We've been getting a lot of questions about insurance. How does it all work? How does it differ from medical insurance? So we want to cover some of those topics for you here today. Okay. So Alexa, what is the difference between medical and dental insurance?
So, a lot of the times, your medical insurance is only going to cover your medical needs. So, your doctor's appointments, your traditional doctor's appointments, ER visits, anything that needs to be done in a traditional doctor's office. Then, dental insurance is going to be a completely separate entity there. So, that's going to take care of everything teeth wise. Obviously coverage and everything is going to vary, and sometimes it is in your medical insurance. However, it's going to be the most basic of basic, okay? So make sure that we have your medical card and your dental card distinguished so we can maximize everything.
Two separate cards.
Two separate.
So a lot of patients also have no idea what HMO and PPO stand for. So maybe that's something we can discuss with them.
Yeah, definitely. So our office is a predominantly PPO office. So it's just a distinction between the different kinds of insurance plans. So HMOs traditionally are going to have a lower out-of-pocket monthly expense for that. So that cost that gets taken out of if through an employer, it's going to be your check or anything that you pay directly to the insurance for that premium monthly.
So HMOs, though, they're healthcare managed organizations,
Yes.
which means that they have contracted with certain doctors or dentists in this case. And if you have an HMO plan, you can only choose to go to that doctor. You can't go outside your plan if you want to utilize your insurance.
Yes.
Versus PPO, if I'm not mistaken here, you can choose your own provider. They have that network, which is an in-network dentist or an out-of-network dentist, but you can see any dentist you'd like.
Yes. So PPO is the preferred provider organization.
Right.
So you can definitely see somebody that's in network get those full benefits. However, under most plans, you're going to have what's called an out-of-network benefits under a PPO plan.
Right.
HMOs typically aren't going to have those. If you see them, it's typically once in a blue moon. But PPOs, you can have both of those with that. Typically, their coverage is going to be better. You will see a little bit more of a monthly premium, taken out of your payment or whatever for that standpoint. It'll be a little bit higher monthly. However, you get better coverage and you have more providers that you can choose from.
Right. Okay. Another question people don't quite, I think, could use some clarity on it is how do deductibles and maximums work with dental insurances? And maybe we can talk about it as well as like major prost and perio, as well as how that applies.
Yeah, so your deductible is set forth by the insurance company, so it's going to vary from plan to plan. So sometimes there is no deductible, and sometimes there's $100 deductible there. So that's something that you have to pay before insurance will start picking up on coverage for any other services. And then going from there, your maximum is the maximum amount that your insurance company will pay out for the year.
What is that typically, roughly?
The most common one that I see is typically about $2,000 a year, typically.
Yep, that's what we see very commonly.
Yeah, very commonly it's $2,000. Sometimes, in those rare cases, there'll be ones with unlimited maximums, but typically it's going to be about $2,000.
Those are far and few in between.
Yeah.
So most insurance companies will only pay $2,000 for the whole year after they've hit that maximum.
Yes.
Then what?
It varies from office to office. For our office, if we are in network with the plan, then we do honor the fees from the insurance company. However, they will be completely out of pocket, which means that the patient will have to pay for them. The insurance is not going to pick up on anything whatsoever. It'll be completely the patient's responsibility.
Okay, and so say I need a crown on one of my teeth here. So, and let's say you tell me that with my insurance, my crown fee is going to be $1,500. Okay, so $1,500. So does that mean insurance will pay the $1,500 right away, and I only am responsible for my deductible?
No.
Okay.
So no. So even though there is that maximum set in place for the different categories, there's going to be different coverage amounts. So it's typically percentages, and it'll work on a scale, and it'll be 3 numbers. It can be 100% for preventative diagnostics, so those x-rays, those prophy cleanings, all that fun stuff.
Exams.
Yes.
Those are all usually covered at 100%.
Typically, yes. In a rare case, there might be some that are covered, less than that, but typically they are covered at 100%.
Okay.
And then from there, you move into basic. Most of the time we see basic covered at 80%, so it'd be 180, and then that major size with the crowns, implants if there is implant coverage, and all that all the major services are typically covered at about 50%.
Right, so that would mean then if there was a $1,500 crown fee, I would be responsible for paying my deductible plus the half of the $1,500, and then the
Yes.
insurance would pay then the $750.
Yes.
That's a lot more clear. And so, what are some things people should look out for in terms of trying to select a good insurance, especially if they need maybe braces or Invisalign, or if they need an implant? What are things maybe they're missing a tooth, for example?
Yeah, so with that, we want to make sure that we're looking for orthodontic coverage for those braces. That's orthodontics there. And implant coverage, obviously, for implants. However, we also want to look out for a missing tooth clause.
Okay.
Missing tooth clause is the largest factor in insurance that can affect that implant coverage. Even if you have that implant coverage and the tooth has been extracted before the start date of the insurance plan, they will not pay for anything.
So if I'm missing this tooth already, then they won't cover it if there's a missing tooth clause, even if they have implant coverage.
Even if there's implant coverage, it was extracted before the plan was effective, then no, they will not cover it whatsoever.
Okay.
Nothing.
Well, I hope that helps sum it up a bit for you. We're welcome to taking any other questions, and we would love to continue this if we can help any further.